My name is Deb Brown, and I'm the CEO for the American Lung Association of the Mid-Atlantic. And today we're in Pittsburgh to kick off our Healthy Air Day. And you may recognize our symbol for this fight, which is the red carriage. Some individuals ask why the red carriage. Well, the red carriage represents the most vulnerable among us: babies, children, the sick, and the elderly, who are largely voiceless when it comes to protecting the air that we breathe. This carriage has been making its way across Pennsylvania, from Philadelphia to Harrisburg and now to Pittsburgh, to bring the message about the need to uphold the clean air protections. The Clean Air Act is critical to our health. It protects us from harmful pollutants. And despite that, the Clean Air Act is under attack by some in Congress. How can lawmakers ignore scientific evidence that toxic chemicals and mercury, as well as smog, harm everyone's health and can cause premature death? Incredibly, some legislators have begun an effort in Congress to overturn the recently passed mercury and air toxic standards, which are estimated to save 11,000 lives yearly. For over 40 years, the Clean Air Act has helped build America's air healthy and safe. If Congress bullies the EPA into weakening the Clean Air Act or uses extreme measures to block its health protections, millions of children and adults who suffer from asthma and heart attacks, strokes, and some people will actually die. The American Lung Association is leading a coalition of organizations as part of this very important Red Carriage Healthy Air campaign. Our goal is simple: to raise awareness about the serious health consequences of rolling back clean air policies. We all need to find our voice and make sure Congress hears us on this issue. We need you to make calls, sign postcards, which are on everyone's chair here, and to help send messages via social media that clean air is critical to our health. Make sure you join us on Facebook and Twitter. It's Healthy Air PA, all one word. Call on Senators Casey and Toomey and tell them you oppose any attempts to weaken or delay clean air protections, and you want them to oppose those efforts too. The American people support our fight for healthier air. According to a bipartisan survey conducted in June by the American Lung Association, an overwhelming 75% of voters wanted the Environmental Protection Agency to update the life-threatening air pollutants. And in new polling recently commissioned by the American Lung Association and announced just today, we find that Pennsylvania voters strongly support clean air protections and believe that we can have both clean air and a strong economy. In fact, 69% of voters support the dual notion of clean air and economic strength. And 59% of Pennsylvania voters also believe that stronger clean air standards will create jobs. Pennsylvania voters also support new protections to limit health-damaging carbon pollution from power plants and updated emissions standards from industrial boilers. So why public support is important to clean air protections? In 2010, nationwide, the Clean Air Act prevented 160,000 premature deaths and 1.7 million instances of asthma exacerbations. It has also averted 41,000 respiratory and 45,000 cardiovascular hospital admissions. The Clean Air Act saves lives, but it also saves our nation millions and millions of dollars in health care. The fight in Congress to weaken this act is intensifying, and we need your voice to join ours as we battle to protect all Pennsylvanians. You only have one pair of lungs, and aren't they worth fighting for? So I'd like to thank you at this point and then introduce Dr. Donald Burke, who is the Dean of the University of Pittsburgh Graduate School of Public Health. Dr. Burke.
Thank you. Thank you, Deb. As Dean of the Graduate School of Public Health here at the University of Pittsburgh, I'm absolutely delighted to partner with the American Lung Association on this important day. We here at the School of Public Health take this issue very seriously. For those of you who don't know about public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of informed choices of society, organizations, public and private, and communities and individuals. And that's what this is about. It's about bringing those groups together to focus on an issue of importance to us all. Public health is that part of the health system that takes place outside the medical system, outside the hospital, and outside the clinic, in those parts of society that affect us every day. Let's take a look back at public health in Allegheny County and the region. I'll bet you many of you don't know our history of being a leader in the nation. Where was the first U.S. filtration system through sand for producing clean drinking water? Do you know where that was? Here in Pittsburgh and Allegheny County. Where was the first scrubber system to remove sulfur dioxide from coal-fired plants? Here in Pittsburgh, Allegheny County. Where was the first Earth Day health? Here in Pittsburgh, Allegheny County. So on issues like this, it is our responsibility to step up and work with other organizations to promote health, and particularly to oppose any attempts to roll back successful public health measures in the past. At the School of Public Health, our job is to provide the science base for these decisions. It is that we have scientists who are studying air particles, but not just counting the particles. They're asking, what's in those particles? What chemicals are they? What effects do those chemicals in the particles have? So that we can make better policies. We have scientists who are asking, if there are particles or other air toxics in the air, where do they go? And what effects are they having on the health, so that we can target those areas more effectively? We have other scientists like my colleague Bernie Goldstein, who's looking to the future and saying, if we're going to be doing shale gas drilling and there are going to be potential pollutants released into the air, what do we need to know about those? And how can we convince our legislators and state leaders to be more thoughtful about involving public health in the decision-making process? And lastly, we work closely with the Allegheny County Health Department. I personally am chairing a committee to review the air toxics guidelines for the county that haven't been updated now in more than almost 25 years, and it's time for that. So, as I say, this is an exceedingly important topic for public health in our county, and I'm very proud to be able to join with the American Lung Association in this day. And I'm also delighted to have met Julie and Jesse, and we're going to hear their story a little bit as well. So thank you very much.
Thank you, Dr. Burke, for your remarks and for hosting us today at the University of Pittsburgh's Graduate School of Public Health. We do appreciate that. Next, it is my pleasure to introduce Julie Franks, who is a Pittsburgh area mom who has 2 asthmatic children and knows the real-life impacts of dirty air and the importance of clean air, and will share her story on just how these issues really do affect her family. Julie's son Jesse is also joining us today. He has asthma, and he's here to show his support for Healthy Air Day. Julie?
A very long time ago, I was a little girl, and back then, asthma was almost unheard of. I only knew of one boy that suffered with it, and I wasn't sure what asthma was, but I was frightened for him. One minute we were having fun on the playground, and the next minute he needed to go to the school nurse for his inhaler. Today, it seems that almost all of my friends have one or more child with asthma. I have no idea what is going on overall. However, I do know for certain that the quality of our outdoor air and air pollution have a significant impact on our respiratory health. In fact, the Clean Air Act has been working for over 40 years to clean up the air that we breathe and protect the health of everyone, especially babies and children, the elderly, and people who are already sick with heart and lung diseases. Unfortunately, some in Congress are now trying to roll back those clean air protections, and we need to speak up and prevent that from happening. I only know of one way to make that happen, and that's education and awareness. The ALA is bringing awareness of the needs to protect the Clean Air Act with its Red Carriage campaign, and also through their annual walks, their galas, their Fight for Air climbs. The ALA has inspired me to make an effort to help bring awareness to anyone who will listen. It wasn't a hard sell, considering both of my children suffer with asthma. I have rushed my own children to the ER many times with their inhalers and nebulizers were not enough, and they would struggle for each breath. It is so easy to take our own breathing for granted. After watching my children go through their asthma attacks, I was sure I would never take my breathing for granted. Turns out I underestimated what that really meant. Last year was my first climb with the ALA, aka my first ALA beatdown. I had no illusions of grandeur on my level of fitness. I knew I was out of shape, and I understood ahead of time that this was going to be rough. Very early into the climb, I never imagined how my heart would literally hurt when I struggled for air. I was seriously wondering if it was possible for me to have a heart attack. I made it to the top, but I was not in good shape when I got there. When I finished, I was flooded with emotion and total physical exhaustion. I wanted air. I needed more air. Walked out onto the balcony of the golf tower for more air, but the climate change from the inside to the outside was so extreme to me that I instantly became nauseous. I saw my boys vomit when their struggle to breathe became more intense, but I didn't know how bad it felt to have your heart beating so hard that your chest hurts, and at the same time you need to vomit, and all the while you're gasping for air. No matter how hard you inhale, you will never inhale enough air. The realization of this made me need to change gears mentally, or I was going to cry. I turned to go back inside and saw firemen in full gear crawling through the same hall I just came through. I became overwhelmed with their efforts, and I needed to get away. Later, when talking to a man who originally encouraged me to do the climb with his team, I shared my newfound awareness with a very raw and raspy voice. I told him of how bad it hurts to feel all of that at the same time. He told me that is why we do the climb. We do this so that we can experience just a bit of what people with asthma and other lung diseases are going through. We both agreed that we were so fortunate that our discomfort was only temporary. My children's exhaustion was obvious, but I had no idea of the pain they were feeling. After the climb, I found comfort in knowing that I would eventually catch my breath. I cannot imagine the fear one must have wondering how long they will linger in that state, waiting for their medicine to work. We can't allow Congress to weaken the air protections that would harm so many. Consider me aware. Consider anyone who hears my story aware. I was humbled and proud to help fight for air. I will continue to help whenever and however I can. My children are now aware of the ways they can contribute and are anxiously waiting to pitch in. My little boy is very allergic to cigarette smoke, which can bring on an asthma attack, but other air pollutants can also worsen asthma, like those from industrial power plants. And it is that pollution from which we need the Clean Air Act to help protect us. I have done everything possible to keep my children away from an environment where they might be exposed to pollutants. I am educating my boys young about asthma triggers, health, and smart choices regarding smoking. But I need help to keep them healthy and safe from air toxins like mercury, which I can't control myself. Please speak up, fight for air, and urge our legislators to defend our health and the Clean Air Act. I will be climbing again this weekend for the American Lung Association stair climb, and that will be my reminder of fighting for breath and why this issue is so important. Thank you for listening.
Bring Jesse up here so that he gets a chance to. And I think Julie's message was really important. This weekend there is a stair climb that the American Lung Association is holding, and there will be over almost 400 people climbing, and we'll be experiencing many of the same things that Julie has experienced. I also want to mention, not only are we working here today with this press event, but we also have television advertisements running. We have some individuals who are going to be out working. We have some of them here with us today who are going to be out talking to students and to other individuals within this vicinity about the importance of clean air and also making them much more aware about this issue. So we want to thank everyone who participated today and will continue to participate in the Healthy Air Day. And as we close out, we'd like to show you an advertisement that, as I said, we'll be playing in the local Pittsburgh media market so that you can fully understand what it's like to have difficulty breathing. So, thank you.
Washington can't ignore the facts. More air pollution means more childhood asthma attacks. Log on to fightingforair.org and tell Washington, don't weaken clean air protections.
All right. So thank you all for attending today, and we'll be here if anyone has any questions or would like some additional information. So thank you.
Thank you.